You ever wonder about the people in family photos, or ever try to ask who these people really were? Every face is a narrow escape or a love story that almost didn't happen. Your family stories are hidden in plain view, you just haven't accessed it yet. There are versions of these rebels and dreamers before life told them who they needed to be. And I'm not talking about the shiny stories everyone knows. I'm talking about the soul-crushing experiences with heartbreaks and real loss. You gotta preserve these stories now. So contact the VietnamStoryBank.com today. No polish, just raw, recorded, beautiful history that makes you sit up and hold your breath. We dig it all up, record it, and hand it back to you. Safe, unerased, untouchable, and unforgettable. Don't let silence have the last word. Go to VietnamStoryBank.com today. Make sure your family's stories are recorded.
Welcome to the Vietnamese podcast. Today, I have Dr. Leu with me. He is a psychiatrist in the Navy with the background of the military. And welcome to the Vietnamese podcast.
Thank you, Kenneth, for having me. I did serve in the Navy. I'm now a veteran, so I'm out of the Navy, but happy to be here and looking forward to our conversation.
Thank you for your service. A little bit more background about you is that you recently opened up a YouTube channel and you really dig into psychiatry in the Vietnamese language. And you speak perfect Vietnamese, perfect English. And I think that it's a huge service to the Vietnamese community, both in the diaspora and in Vietnam. I'm sure there's so many people that are tuning in to your episode. So thank you for your veteran service, and thank you for establishing this new YouTube video series.
Thank you for the plug. It's Dr. Leu, or the handle is at Baxi Leu, Bacsilu. It's caught me by surprise how much positive response I've had since starting this. After I went to Vietnam for my second round of a medical mission there, and met a friend who basically taught me the technical side of how to start a YouTube channel. And I've been wanting to do this for some time, but just the technical steps of how to put a clip together, how to post it and be compliant with YouTube posting, rules and regulations. And my focus was mental health in Vietnamese, intended for our Vietnamese audience. I think there's a huge gap in that realm, and not surprising, but very pleasant to know that I had overwhelming response in people asking questions, people being open to admitting there is a mental health need, there is a mental health concern here for us to work with, rather than more of no, that doesn't exist, or we don't address that, we don't talk about it, stigma, shame, and hide kind of deal. It's it's in the open. I do have depression. I do have anxiety. I am living in Vietnam, and here's my limited range of resources. What can I do? And the same actually question can be applied here. I'm in America. I don't have access to all these things. What are my options to improve my mental health? So I found it to be extremely rewarding, and I look forward to continue to communicate and connect with the community about these topics, ranging from sleep to depression to anxiety, PTSD, post-traumatic stress disorder, my bread and butter, and all the ranges of bipolar, schizophrenia, medication. Should I take it? Should I not? And addiction, right? What are the challenges in treating addictions? Relationship. I love talking about relationship and how all this pop culture stuff is going on. And so endless topics. It's just, where do I find the time to, concentrate the material in a meaningful, helpful way? So I look forward to sharing more of that with anyone willing to listen.
Before we get to all the good stuff from why we're here, I want to compare notes with you. This is a question I'm beginning to ask everybody in this next 5 years of my podcast journey, which is, what is the next evolution of the Vietnamese people globally? Not only just in Vietnam, but also in America. And what is our job? And the reason I bring this up is because you just went back to Vietnam recently to go to a concert, Mỹ Tâm concert. I just got back from another concert. It's weird that we were both there for concerts. I was there for the Hà Anh Tuấn concert in Dalat.
Yeah,
you were there for
awesome.
Mỹ Tâm concert. Yeah, and when you're sitting in an audience in Vietnam now, and you're looking at the performance and the sound stage and you probably grew up in the era with me with Paris by Night, and we went to Majestic or the Ritz or, Orange County.
Yep.
But this stuff is taking it to a whole nother level. You're sitting, I don't know how big Mỹ Tâm concert was, but mine was 20,000 people in the audience, and it was just electrifying to see. And I turned over to the person that I went to the concert with, and I said, I think I found my next question. My next question is, oh my God, like, this is the evolution of society here in Vietnam. And it's, went to the Dolby Theater in LA where the Oscars, Hà Anh Tuấn actually did a concert back in October, at that, the same sort of like vibe. And I'm like thinking the evolution of Vietnamese people all over the world is phenomenal. So I wanted to get your thoughts on that.
Great question. And people might think I'm crazy, but I've been back to Vietnam 6 times in the last 2 years, and mixed leisure and business. A lot of it is traveling, and a lot of it is in this new excitement of perhaps writing a book or a documentary and following the Vietnam history story. And this most recent trip was purely leisure with Mỹ Tâm, but sitting there in Vietnam's biggest stadium, Sân Vận động Mỹ Đình, right? And thousands, I forget the exact number, but she broke the record in having the most amount of people. It's just sold out seats, standing in the front and sitting in the back. The whole stadium is lit up with these light sticks. You can't help but feel joy for such a war-torn country's history, to feel like this is where we're at.
Arrived, right? That's the feeling you get.
It's like, they're not worried about dying. We're worried about, like, are we going to get a good seat to watch this show? And we're enjoying the music that this, to me, is a remarkable performance artist, singer, who has maintained such sustainability and viability, wholesomeness for over decades. I mean, kids growing up and now are adults having kids and still liking this. I barely knew about her in the last 5 years. That's how much under a rock I am. But, it's...
Me too. Same here.
Yeah, but, her charm, her wholesomeness, and her artistry, what's not to like? And to see the positive influence on the country, to see, like, how much goodness can come out of one person's artistry is remarkable, impressive. And you leave all the other parts aside, like, is it us, is it them, and all that stuff. Just leave it on the side. Just enjoy the person for their performance, and enjoy the atmosphere as if you're just in a concert anywhere else in part of the world. Don't start putting in things of like, oh, I'm here, I'm with this, I'm with that. It will taint you, and it takes away from really the diaspora. Is we've had to do this. We're in, a transition of a different mindset. We get to experience this mindset compared to the folks who are in whatever mindset they had to do in their survival and development. And now we're in the same space and we're enjoying this. And I was like, benefiting from their creativity and like smartness. It was like, I got to see Mỹ Tâm like behind the stage, right? I got to like shake hands and give a gift. And it was like, dude, that this is from someone's like motivation and willingness to go the extra miles to figure all this out, to just like give us an opportunity to be that much more of an experience. Heck yeah, more power to this kind of growth and interest in the arts, interest in joyful and wholesome parts of life. The whole reason why we're working so hard, save up for these tickets, go. I spent 4 days there. I think I spent more time flying there than actually staying there.
I love your answer, because it really is showing the shape of the blending of our new generations, because in Vietnam, they don't question it. They don't have identity issues. They really do not have. We are, every time I talk to somebody in the media or in the entertainment sector now, it's diaspora people who have like this major shakeup with identity. And the more you go out in international waters, the more you're going to be like confronted with this identity thing. But in Vietnam, kids that are growing up in Vietnam, they leave Vietnam, they are just standing tall. They're just, strutting there. They're walking around like, that they're just complete people. Meanwhile, like, guys like me are like, comparing everything. Right. And It's a deadly place to be sometimes.
Absolutely. It's just reframing and reorienting and remembering who we are, what's our identity, and what we are about, what we want in life, and just keep an open mind to all that is a lesson, all it is to embrace, and what we're thankful for. It's the same stuff I give to my mental health patients in therapy or just motivational talks. It's like you could very easily descend into a world of what's wrong with me and what's not going right and what I don't have and what I don't like about
Yeah.
myself, what I don't like about life. And it'll just fester in that energy level, right? And so it doesn't matter who you are, where you are, you can still have this other mindset of, I'm thankful for these things that I do have. And I'm thankful for the lessons I've learned from the things that have brought me challenges and for me to overcome and for me to know the strength that is within me to do that. So I try my best to encourage for what are you thankful for mindset? What are you grateful for? It just elevates your thinking right away from a state of not having to a state of what is possible and doable because of what I am and who I am and what I do have. So, I, it doesn't seem to matter boundaries or nationalities at that point, right? It's just
Yeah.
what we're thankful for and what we can do in the context of our capability and gifts and talents, right?
Before we get started into the heavy stuff, I need to ask you to define the difference between psychology and psychiatry. I think because those two terms are very closely related. And so for the lay person like me, who often, wonder about the responsibilities of each of those roles and professions, psychiatrists do different things, psychologists do different things. There's overlap. And I ask you that because it'll give us some context about psychiatric drug prescriptions that I'd like to really address on this podcast.
Sure. Great question. I love answering this question again and again, any chance anyone asks, because it helps to give the whole complete picture of what mental health care is. On the psychiatry side, my background, you go through medical school. You get an MD or a DO degree. You go through psychiatry residency to learn about, the core of it is medication management. What psychiatric meds to prescribe. I feel like it's a loss because psychiatry continues to be more defined in just the medication realm. Psychiatry back then, when we first learned about this field, is so broad. I mean, like you're talking about psychology and therapy and all kinds of modalities. And you had to learn so many things beyond just like what is Prozac, Zoloft, Wellbutrin and all that, right? So to me, it was great that I had the didactic and the foundation of psychiatry to know what to do in the case of a psychotic episode, in the case of a bipolar manic episode, in the case of a severe depression episode. You need to know your meds to take care of these kind of like extreme ends of mental health. But after you get the meds in, and then the person now is within the realm of reception, ready to understand about themselves and do the therapy, you kind of gotta synergize with the psychology side. My counterparts in psychology is a PhD, right? That's the highest level of the therapy side. There's many other ones. There's like licensed clinical social worker. There's like a licensed
MFT,
psychiatric, MFTs, marriage family therapist or
therapy.
LPMHC, right? And nurse practitioners that go into mental health as well could do the med side or could try, the other aspects of mental health. But psychology PhD is the highest trained, the most amount of time involving research and clinical, where you're learning different modalities. If you're going to be providing care for couples, what kind of couples therapy modality you need to know. If you're providing care for family therapy, what what clinical, expertise do you need to have everyone in the room to talk to, right? And if you're a child psychologist, are you a child psychiatrist? That's also a subspecialty under psychiatry, right? And half the time, child psychiatrist, psychologist, who do you treat? You're actually treating the parents more than you treat the child, because they're also contributing to the well-being of the child or the lack of it. And you got to coach the whole circle of people to
Wow.
get the individual better, right? It's like, hey, my kid's not acting right. I was like, well, let's take a look at where the origin of this is. And, you break it down and you're like, he sure could use some positive role modeling, right? We're not going to call it out outright, but there is a lot of influence and imprinting, and we got to work at if we're asking for these things and changes in people. What changes are we willing to work within ourselves? And that goes for everything. Same with couples, right? They go and it's like, fix my husband. You fix him, our marriage is good, right? I'm like, well, let's think about how the dynamics is evolved for us to feel like we need to fix and change the other person for the sake of our own happiness, right? And so all that needs to be unpacked. And then the same goes for therapy. It's like having the sensitivity to synergize with the doctor that prescribes so that the patient can tolerate the distress when they're going through therapy. So a good example is what I do, PTSD, post-traumatic stress disorder. Guys have extreme amount of anxiety, very fearful, very hesitant to go into stress provoking kind of environment, crowded places or noisy places or just places where they feel like their amygdala is lighting up in scanning for danger. And if they're always scanning for danger, they're likely not in the mindset of taking in therapeutic suggestions. Um, I'm always watching out, like, what are you going to do to me? What are you going to do to me? What is going to happen to me? Right. So with our hardware, I call it, it's like, okay, let's get some meds in. Let's help with the anxiety. So your heart is not beating at 120 all the time. Let's help with the depressive side. Let's help with things that make you crave alcohol less, right? So if I put a combo, a starter package to help with your PTSD symptoms, and we kind of start seeing the positive response to the medication, what we arrive at is a person that's more in the doable range of emotions rather than the extremes. And we're in the more like cognitive, right and ready kind of mind to receive the therapeutic interventions. Then we have this therapist, the psychologist, trauma therapist do the work. Tell me
Oh,
about
wow.
the most traumatic incident that you had. Tell me how it makes you feel, what comes up in your body, where does it sit in you, where do you feel the pain, what emotions come up, what thoughts come to mind, and let's go with that, right? So these ways of extracting the information out comes easier when the person feels biologically safe and medically stable to do the work without having to feel like, oh my God, every time I feel anxious, I'm going to go get a drink. I'm going to go take a benzo. I'm going to go do everything that is maladaptive, but it's what I know and what I have access to, and I do. But now I'm okay with sitting with the discomfort. I don't feel as uncomfortable, and I can stay within this space so that my therapist can really challenge me and put in some difficult concepts with a clear and sober mind to take the information in. So I think that's good, is a good example of the synergy in the best of both worlds of having the care of a psychiatrist and a psychologist. How feasible it is in today's insurance age, and how cash, friendly it is, and how cost effective it is. That's a whole different matter.
Yeah, yeah.
Um, yeah. So that's my long winded answer for psychiatry,
Well,
psychology.
in terms of actually, we hear so much now, and I know we talked about this earlier before we started the podcast, is that, you come from a very military world in your treatment and the patients that you've dealt with as it relates to veterans. But big pharma is getting a bad rap for like just putting a lot of pills out there, and people are getting addicted to it. And, we're really living to kind of consume all these big pharma products. And yeah, I'm assuming a lot of it, works, obviously, because otherwise they wouldn't be in business. But how much meds do we need for our body, for our minds to get better? Can we not go to church? Can we not go to temple, Buddhists? Can we not talk more to therapists and use our words to get better? How much medication helps? How much does medication help the body to help the mind function?
Good question. I think the boring answer is it depends. And in mental health, most of our answer is it depends, because we like it to be on an individual basis. Not everyone, I mean, there's an extent of a stereotypical thing that we can say it's similar enough, but then also everyone is different enough that we would like to approach it on a very individualized model. I love the individualized model because you you have to really hear and know and take the time to encourage the person to really understand themselves before we even choose what treatment it is, right? I don't say like, take this med and that's it, right? I actually offer a risk benefits alternative discussion of like, here's what it looks like if you do decide to take this antidepressant. And here's what you can expect if it works, right? If it doesn't work, here's what you can expect for us to do next. And then here's the benefits of it, and here's the alternatives to it, and here's the risk to it. If you don't take it, what would that look like? And if you have all the other options of, let's say most people say like, give me the natural stuff, give me the mindfulness, breathing, yoga, exercise, diet, and just go out and do all these fun stuff, and I'm good, right? If that was true, and if that was all that was needed, I think we wouldn't need any of this, right? Yeah. Right. But the point remains that there is an individual journey of each person. And if you ask the person who has come back from the brink of, I want to kill myself, and I'm so thankful that this medication has helped me to stay in a more doable range and to be in a more like life is hopeful mindset rather than life is not worth living mindset, we've done our job, right?
Yeah.
So it depends, because there's four components. I feel like there's the doctor, there's the patient, there's the the pharma, and I guess like if you want to call it the world of how after you take the med and you do what it does to you, how do you interface with the world, right? And then how do you interface with me as the provider who kind of like tracks your progress to adjust? And then, how does that play into with the culture, and then also the business side of things with medicine, right? Thank goodness we're in this era of more meds than not. Thank goodness that we're in less of an experimental time frame versus like lobotomy or some other very, old style kind of way of approaching mental health. But we just got to stumble and learn through it all, because it was maybe the best of intention of everybody, but it didn't have as much of an evidence-based approach as what we have now. So thankfulness for that. I do think there is a big business influence, like anything else. Pharma has its ways of wanting to make the money to make up for its research and all the regulation it has to go through, and whatever else it does, in saying like, I got the special drug no one else has. I should be able to have the right to pay, to make people pay for what it wants. But then, I don't know much about that from a government prescription kind of guy, right? I'm there. If you're in a system where you're just prescribing what is in your formulary, and that's for the most part, a large percentage of your prescription, your opportunity to get the different prescriptions will be less, and then wanting those prescriptions will take a lot more steps before you can get it. So to be fair to the folks that can prescribe the new stuff and to experiment with the new stuff, well, it's if you don't do, you wouldn't know. And then you got to try to know, like, is this that much better? Is this new version of Prozac 2.0 or Zoloft 3.0 the better of what it is before? And are they really effective, or is it just a marketing thing where you change a little molecule and you call it something else just to maintain license, like uniqueness, to continue to charge people a premium price for it's really just the same stuff as before. So, um, to simplify, it is an individual journey of a person that is having a difficult time of, I'd like narratives of like timeline of like, who were you before? Who are you now? And what has happened for you to be where you are, for me to better understand? Is it a medication question? Is it a personality question? Is it a therapy only kind of thing? So, yeah, I'd love to have just a therapy only. You wouldn't have to need the meds, but sometimes you're going to need some of this stuff to lower the sympathetic system, to enhance the safety factor inside you, to go to a psychologist for, the therapeutic work. Excuse me. One thing I did during residency was I actually did a whole course in psychoanalytic therapy, so that I would know if a psychologist was going to do a therapy, what would it look like? And so I basically tried to get into their world and learn from theirs, and not just stayed on my side of like, I prescribe the med, you do the talking. So most of my patients, I basically offer both. If I'm seeing them in a treatment context, whether they know it or not, I'm applying psychodynamic psychotherapy principles along with my psychiatry med management balance. And I love that, because I just don't feel like I would feel like I have enough to isolate and compartmentalize and do just the meds. But that's a personal, thing for me.
How much of Vietnam and Vietnamese people in America is beginning to tune into the idea of getting mental health, getting to be better? And I'm not looking for any quantifiable sort of like percentages or ratios here. I'm just curious. It seems like you have your ear to the ground in Vietnamese communities. Just wondering how much of our previous generation is now understanding mental health is a real deal, a real issue.
I went to a medical organization to ask if I could volunteer my mental health services to Vietnam 3 years ago. They said, we got to ask permission. So they asked the Vietnam government, and the summary was they're not ready for it, and they don't think they need it at the same time. So that organization basically told me, you can go as a primary care doctor, but you can't go as a mental health doctor. So I was like, whoa, that's unfortunate to hear.
Yeah.
2 years ago, I went with another organization, and there was also internal debate of like, we're not sure, but the bottom line answer was, let's give it a try. And I was very excited, because at least it's better than a no, right? So we went as a formal designation as a mental health bác sĩ tâm thần, and that was great. We had tremendous reception, and we did a good job in being the ambassador of mental health for the population in need, in the underserved, and doing this medical mission. And last year we repeated it, and I got even more. I saw 75 patients in 3 days, in a matter of like maybe 6 hours a day. And this is like rapid fire, one case after the next of like, I'm not sleeping well. My husband is beating me. I'm stressed about life. I think I want to kill myself, or I don't think I'm on the right meds. So the whole gamut of what psychiatry would see here, I saw there. And, you can see a need, and you can see a willingness to ask for help. within that that context of that medical mission. I think it could be extrapolated to the general community of saying like those are the same types of life problems people would have, right? I'm not sleeping well. I'm worried about my finances. I'm worried about my kid. I'm worried about my relationship. I'm worried about myself. A lot of the worrying, rối loạn lo âu, the anxiety, right? A lot of trầm cảm, right? All these technical words I didn't know before I started YouTube, and I had to like really learn.
Wow.
And yet it's already heavily aware in the Vietnamese community, and it was kind of refreshing to see that we're not like having to describe at the basic level anymore, and they are aware, and it's just more of like, what can you do to help me, right? Contrast that with over here. I do see so much during my day job of non-Vietnamese and military types. So the residual leftover time that I do see Vietnamese is a lot less. So it's hard to say the representation of it. But of the few that I see, um, I don't see. I do see a willingness to ask for help again. It is a mix. Some are less willing to try this and that, and some are more open to. So, in the grand scheme of things, I would say Vietnamese are more open to it, are more receptive to the idea of asking for help and getting the help. I do face a lot of dismissive people, like thinking like, it's not necessary. It's just whatever, not real medicine. And, we have so much business from the ones who need it that I don't have time to sit down and saying, yeah, there's this encounter.
Yeah.
It's just, we'll work on the ones that are willing to get the help. So yes, the need is there. The willingness to get the help is there, and the openness to understand the degree of help and the, sort of like, do you know where you are in your mental well-being kind of deal? I feel like we're overall improving. Yeah.
Yeah, and it looks like that as a society as a whole. Looks like it's everybody's sort of tuning into this mental health deal.
Yes. Psychiatry residency training used to be seen as not as popular. It's more like, it's a just not a field that people want to go into for whatever reason, of thinking like it's just, not the
Yeah.
fun, exciting residency. But now it is one of the most sought after
Wow.
when they realize how much in demand the job is and how rewarding the job is, and what an amazing lifestyle of work-life balance it brings. You work this many hours, you have this many hours to go play. It's like, it's not like you're just tied into it and you're sucked into it and you just don't ever see the end of the day, and then, doing other stuff you enjoy doing. So, so the world as a whole recognizes the need for mental health, and the world as a whole knows we need to train more mental health doctors to chase this need. So, which spells out good for our business for now, I guess. So we're thankful that we're in demand.
So, as it relates to the improving mental health, general mental health of the Vietnamese community, I feel like it's getting better every day, but we're not quite out of the bushes yet. We're not in the clear just yet, because I feel like there's these patterns that we have within our culture and our tradition. There's these things that prevent, and I mean intimacy from man and woman to parent and child. Intimacy in its real form is being real, right? I feel like that is such a big thing that causes a lot of mental health problems. And it causes like this inability for families to be really real with each other. And it's a clash between, being able to kind of like be real about things, but yet it affects us on a very deep mental health level. Do you encounter that in your your everyday dealings with people in the Vietnamese community?
Yes. The whole politeness and the cultural deference and the trying to say things without saying things. and being indirect, right? It can be exhausting to try and read. What are you really saying? How can
Yeah.
I really hear what you're saying underneath what you're not saying? Um, to be fair, I'm learning within my own day job, working, in the VA corporate structure or the Navy side of things before. Um, we do a fair amount of, saying without saying, right? And you gotta be a poker player to go into a board meeting to know, like, okay, when to speak up, when not to,
Yeah.
and how to listen to the message when they're not saying it. All the same, right? So do I say this is a Vietnamese thing, or do I say this is a human thing, a personal thing that we just got to learn to have more emotional intelligence and awareness to be sensitive to how humans communicate? And I did not think it was a big deal in growing up and staying in the cocoon of like Orange County and among the Vietnamese community. But when I had to transplant myself to out of state schools for medical school, for masters, and then all that other Navy stuff, and different organizations. I keep running into different organizations, and the motif repeated itself of how communication happens, the nonverbals versus what is said, right? The body language, the type of culture that this organization is in, and how do you read the information? How do you read the people in the room? How do you know who you are to best match the needs of the service that you're as a participant of? I feel like um, the stereotype went away, and it more was like, what do I need to do to improve my skills of understanding and reading people? That was more important. Like, no matter who, I got to still know, is my boss really saying that? Or is
Yeah.
my wife really saying that? Do I really understand? So, um, but the cultural nuance, I'll try to stay on the point. The cultural nuance of us being Vietnamese, and um, how we just can't really say it because we would either be judged as too harsh, too honest, too brutal, too blunt, or they're not ready to listen, or you don't want to offend. The range is there, right?
Yeah.
And at what cost is that to the authenticity of the relationship versus in what environment can you still say, am I just don't feel this about you, or I really am frustrated with you doing this, right? Can we have an honest talk? I think it could be there. And if you're talking about generational, we are better off now in having that dialogue than we were before. I don't think our parents could have that dialogue compared to the current folks. If we're bringing it up, I think the folks would agree that they have a much better time communicating with their spouse counterparts than their parents did. So, as a whole, I would think we are more for the sake of, like, the cultural shift, the increased awareness, the openness, the desire to remain authentic and genuine. It has certainly helped, but the nuances of the cultural aspects, I think you get it more when you're actually in the room with the couple, or when you're with the person and you ask them, I wonder why you didn't tell them that you were so irritated. I wonder what held you back from really saying what was on your mind, but you're here just, you're cussing them out right here in this room. But
Yeah.
there you were like, I don't know, I couldn't say, or I didn't want to say, and I'm just frustrated. And it's like, yeah, so let's work on why you dismissed your own emotions and had to put on this face, but then now you're here triangulating and saying, like, rescue me from this emotion that I'm having, right? So um
You
it's
know,
it's a
this is a big problem in Vietnamese culture, and I think a lot of Asian cultures that use honorifics like bác chú cậu con
right.
cháu, right? Because when you start to throw the honorifics down, when you start to throw titles in, you don't want to disrespect your grandmother. Yeah, thưa bà, cháu muốn cái này. It's just it goes into the brain. Yeah,
Right.
you know, you're bowing.
Yeah.
You actually embody the physical side of the
The
respect.
deference.
Yeah, the
Yeah.
deference, and you know, it
Uh-huh.
becomes a thing, and it really is, I think, an impediment to our. You know, I wish we had a live show, you and I, just to take in incoming rounds, right? That would be
Uh-huh.
fun.
Uh-huh.
You
Yeah.
know, like a Love Line, like back in the '90s. You know, like
Uh-huh.
Dr.
Yeah.
Drew and
Uh-huh.
Adam Carolla had
Uh-huh.
Love Line, and they would just, you know, take all these questions about relationships and sex and all
Uh-huh.
the, you know,
Uh-huh.
Dr. Drew was
Uh-huh.
a medical doctor, and you know,
Uh-huh.
I think he was a psychiatrist too, if I'm
I
not
think so. I
mistaken.
think so.
Yeah,
Yeah.
yeah.
Uh-huh.
I'll play
Yeah.
Adam Carolla. You play Dr. Drew. Just we'll
Hey.
do it in Vietnamese. We'll do it in
Vietnamese
Vietnamese.
version. Yeah.
Yeah,
Mm-hmm.
yeah. Do a Vietnamese version of that. That would be cool. But I think it's changing in Vietnam. I think that there are therapists and psychiatrists. I don't know about psychiatrists, but I know therapists are coming onto the scene. But there's no governing body. There's no 3,000 hours as a MFT, you know. But I know that a lot of, you know, I mean, the more money you have, the more problems you're going to have. And I think more money, more problems, right? As they say.
Yep.
And as a
Mm-hmm.
developing country that is becoming more and more rich as the days progress, I think the therapy business is going to be it's going to be a booming market.
My wish is, as an educator, dreamer kind of thing, is to enhance it. If you're going to be treating people, you should do it responsibly. And if we can standardize care and bring some of the safety factors, especially if you're talking about in the Vietnamese context of deference and like do what the doctor says or do what back says and do what says. And if they are not with the most informed academically or scientifically to make these decisions, and we got to defer to them, we're not doing ourselves a favor. So to form a, you know, an education system that allows for residency training and equivalent, and you know the safety rules that goes into like protect the patient's best interest. Like, I wonder, what is the restraint laws look like when you have to tie someone up in Vietnam?
Ooh,
I wonder if there is even a law, or
wow.
because over
Yeah.
here, if I had to put any patient under any kind of like tying down in the bed because they're, you know, scratching themselves or they're flinging poo at the doctors, you tie them down, right? But then even then you have to write out like clinically why and how long you're going to do it for, how you're going to reassess, and how you're going to like make sure that you can not try to restrain them again, you know, what measures you would take. So it goes through a long list of things before you can put a person in restraint. What's the standards there, right? So I would love to see some kind of patient protection, standardized educational format to that. And if I can be in any part, way, shape, or form to participate in that, you know, it would be great. It would be a synergy of like, you know, using what I enjoy doing to enhance the quality of life for all involved, you know. So yeah.
Yeah, that's something. That's just one little aspect, one sliver. Yeah, what do they call it? 50-51s or 51-50s? Is that what they?
5150. 5150 is the first 72 hours. 5250 is the next 14 hours. So if you believe a person's medically and mentally unstable when you first see them in the ER, and you think they'll be a danger to themselves, a danger to others, or they're gravely disabled and they can't take care of themselves, you as a psychiatrist have the ability to put them on a 5150, involuntarily admit them against their will. They will say, I want to go home. I don't want to stay here. But they still have thoughts of wanting to hurt themselves. They still have thoughts of hurting other people. They do not have that privilege to be discharged, right? You would hold them in after the 72 hours, and you feel like, I don't think they're that ready. They need another 14 days in here. That's the 5250. On the 5250, you actually have to prove to the court that the patient needs to stay. So the court assigns a judge that comes to the psych ward and you on the doctor side and the patient on the other side, and the patient would state their case of why they think they're ready to go home, and you, the doctor, would say like, I don't think this patient is clinically ready to go home. The
Wow.
judge hears both sides and decides to uphold the 5250 or not. If the patient is further impaired and after the 5250 and you still think they need to stay in, you do what's called a temporary conservatorship. That's 30 days. And then a permanent conservatorship is for life. You find a family member or a state designee and you just keep this person, basically under a mental health care institution. But that's on the rare end of things. More of the percentages is they are cleared within the 72 hours, they're cleared within the 14 days, and they go home. So, but yeah, those kind of rules, it would be nice to see what we have standardized in, a system that is going to integrate more of mental health care on a system-wide basis, kind of that. I don't know what it's that like in Vietnam, but I would love to see and hear and
I'd
learn
love
more
to
about
hear
it.
too. Yeah, love to hear it.
Yeah.
I'm gonna make a completely left turn here for you. I'm gonna as I'm hearing you talk about all this stuff, it's very mechanical, and I'm thinking about human beings as spiritual beings. And for somebody like you who's been practicing psychiatry and giving therapy, verbal therapy to patients all these years, and you've probably seen people become not themselves. Do you ever think about like what's in the body and the mind that, is it a spiritual thing? Is it just a mechanical thing that we are, there's chemicals running around in our brains? What's your spiritual stance on human sort of thinking and behavior?
Oh, let's see if I can tread this appropriately for not to hurt anyone. On the extreme side first, the easier side, on the extreme side of clinically assessing someone, there is a tendency of, we say like, this person's hyper religious. This person is, just like is on the extreme of hearing Jesus talk to them directly, or like they are the Messiah and they're going to do these things, right? And then, I don't think we go into a debate of saying like, are they really Jesus? And we don't know it. But we just say like, okay, this person is of this mindset and does not appear to have within the normal range of the mental status for us to function on the society level. And is it impairing their day-to-day functioning? Is it impairing with their job, their family relationship, and their own health? If it does hit those realms in a very impactful way, you would then call it a disorder, right? A mood disorder, a schizoaffective disorder, or, a schizoid or a schizophrenia, right? It depends on, not schizoid, schizophrenia. So, you make a Western diagnosis to it of like, these are the core symptoms, the auditory hallucinations, the visual hallucinations, and you just label it and you just slap on the label and the treatment. That's the mechanical side, but it is what it is. And you go for that as, what to address the issue. On the ends of people, the fervor of the spirituality, the feeling like they are so close to God, they are such a connection, and they, if they're functioning and they're integrated and they are not negatively impacting their own health or the relationship of those around them, who are we to say? We leave it be, right? More power to you. I only enter the conversation when either the patient, him or herself, or the family member says, or the cop that brings them in and says, this person is negatively impacting their family and their community, and they believe they are Jesus, and they're going to do all these things to these people, and they're just not within the realm of redirection and redirectable. and to kind of like come back to how we socially normalize and believe a person should be in believing Jesus, but not believing that they are Jesus. So I, I, I've learned to, what I really like about psychiatry that has taught me is hold your judgment even more so. I've learned to be less judgmental, and just more patient and open to meeting the patient where they're at. It sounds easy, but it's difficult when you have so much of stereotypes and biases of who you are, the lenses that you bring into the world of seeing people, and you try to have on neutral lens. But then, it's just like if you have certain values and principles that doesn't agree with this person and you're the treatment provider for them, how will you not contaminate the treatment relationship in a fair way, right? Sometimes it's okay to excuse yourself. It's okay to say, like, I do not believe I have the best of consistency in not having such strong counter transference to this person. And I would like to recommend this person to find another provider that they would feel like is more, attuned and agreeable to their values and beliefs. But I don't think I would be a fair person in providing care for this person. So yeah. Have I done that? It's more of by the time the patients realize that they are not a good fit for me and they excuse themselves. I haven't had to say, like, you got to go away. I can't treat you. I'd rather allow for it. And then they find it for themselves. So there's that.
Yeah. I asked you about that, because I think the next evolution sometimes for me is to really be in Vietnam to be a part of the therapy community. I gravitate towards that a lot. And, there's a lot of religion in Vietnam, and that opens up another question for me, which is your thoughts on, psychedelics and mushrooms and all of these other, they're ancient forms of medicine, but to American society, they're new. They're new, untested, not a whole lot of empirical data on these new modalities of treatment, but it's being introduced into PTSD in the military, right? Psilocybin and all of these other, Mother Earth kind of treatments. What's your take on all that? And I ask that again because in context to one day Vietnam adopting all of these treatments, I'm curious to hear your thoughts.
I am on the conservative side of it. I'm more of like, let's wait until all my smarter friends can figure it out and do all the research and show me a compelling treatment algorithm that is really evidence-based and compelling. Because it's still in the experimental phase, I hold my opinion on its effectiveness. It's whether it's a yay or a nay. I have way more smarter friends that are doing that. I stay in the, like, I'll stick with what I know. I have plenty of work to do in just the realm of the what's already approved. And when that is like all done and proven time and time again, it's effective, then bring me in and teach me and I'll follow suit. For what it's worth, people who think like, let's just say cannabis is so generally accepted and now you can get a medical license for it and you can do all these things and then no one questions you anymore using it. Have I seen enough improvement from people taking it, medical marijuana, that they no longer need anything else and they're doing fine? In my realm, I see more of it hasn't done enough, and it needs a whole complete picture. Like how I said before, you need a psychiatrist, you need a psychologist. The self-medication, the word self-medication worries me, right? You're not formally trained, you don't know enough, but then you just want to go with the belief that you have that you want the natural stuff and you don't want the doctors to tell you what to do, nor do you believe in the psych meds, and nor do you believe that the talk therapy would do anything. So what's accessible, what's easy? Let me just go out and buy this thing and use it. So I find that the guys who haven't had success with all that, doc, I tried it, right? I'm still an angry guy. I'm still an anxious guy. I'm still this not happy guy. I'm like, yes, I'm so glad you recognize and have an awareness of that, because that's half the battle. Let's work on it. Let's understand the root of it from a therapy angle, from, the hardware side. If that didn't work, that means like there's other things to try. I'm not saying everyone needs to try antidepressants. I more often than not start with like, what can I do without needing the meds? And only when the conversation arises to, I think there's an opportunity here to do more with this, then we will introduce that. And I get a lot of buy-in from my patients because I don't push it. I let and I always do my best to describe all the stuff before I do. Like, here's Prozac, what it can do for you. Here's what most people think it will do, and here's what it actually does. Sometimes people think like taking a med and then having it does well is them being addicted to it, right? I was like, I don't want to be addicted to antidepressants. I'm like, can I help explain that addiction is on a different algorithm and a different mechanism? This is just what we designed it to do. It's to go into your brain, saves you the amount of serotonin you have so that you feel less depressed. That's not addiction. That's just science. Okay. Addiction is when you feel like you can't control it and your body is like adjusted to the dose and you need a higher dose to feel some kind of a rewarding effect. For example, a benzodiazepine, Xanax, Ativan, right? Or a stimulant like cocaine or meth, or the legalized form, Adderall, and they get it and misuse it from somebody. Or alcohol, right? I was like, I drink to sleep. I don't want to drink because I'm an addicted person. But then it slowly becomes, over time, I drink it because I can't sleep, and then I can't be not angry without it, right? So it just drives my decision making day after day. If I'm angry, I need to drink. If I'm not sleeping, I need to drink. And it slowly becomes a dependent pattern where you can't function without it. And then it affects you legally, occupationally, and marital and financial, right? So those are the realms we look for in addiction. That's like, hey, all these things are not going your way because of this one pattern of behavior. So I try my best to explain the difference between taking a medication that is effective versus mistaking it as being addicted to a medication, which has its own realm and explanation for those things. So,
Great answer. I want to experiment this next final question in Vietnamese. And the reason I want to play with this right now is because perhaps there are some of our listeners who are listening from Vietnam or are Vietnamese but don't speak to their parents as much. And perhaps this next question could be shown to their parents to show that both of us are speaking Vietnamese. They could show their parents so they can go to your channel. So I kind of want to do a plug, but also have a little fun with the question. So if you don't mind, maybe we do a few minutes in Vietnamese. And I think that's always a fun thing. So here we go. And we could do one or two questions, but I'll start with one that is on my mind. Thưa bác sĩ, Kenneth muốn hỏi là những cái phần mềm bên pornography và AI và những cái mạng xã hội, nó có những cái yếu tố gì, nó có những cái side effect gì mà xã hội Việt Nam đang chiến đấu từ Việt Nam và bên Mỹ. Những con em bị ghiền đánh máy vi tính, thì ngày nay cái cách mà giúp con em hoặc là giúp xã hội thì bao nhiêu lực lượng mà trong ngành tâm lý á, những người bác sĩ tâm lý và những người mà làm trong lĩnh vực tâm lý đó, thì bác sĩ có thể kể cho Kenneth nghe là
Ừ.
bên Việt Nam hoặc là xã hội và bên cộng đồng Mỹ hải ngoại, mình có thể nào mình trực tiếp giúp được những người con em trong xã hội không?
Cảm ơn. Kenneth hỏi câu này rất là hay, và đó là một trong những cái rất là trầm trọng và là nguy hiểm nếu mình không biết được là cái kỷ luật của mình. Thì cái câu trả lời này á, nó có cái phần đầu tiên á, là khi một người bố mẹ đem đứa con vào đời và lo lắng cho con, che chở cho con đừng có bị nguy hiểm, con bệnh thì ba mẹ cho con thuốc, con muốn lái xe đạp thì ba mẹ dạy cho con, xong rồi con nhớ gọi cho ba mẹ khi con bị gặp cái này cái kia. Lúc nào con cũng là trong cái nơi là rất là nguy hiểm, hay là có thể dễ bị rơi vào cái nơi không an toàn để mà ba mẹ che chở lo lắng cho con. Bao nhiêu phần mình lo lắng hết, từ ăn uống tới lại đi học tới lại xe hơi này kia đó, mình lo hết. Tự nhiên mình đưa cho cái phone, cái là nó mở một cái thế giới là bao nhiêu người lạ, bao nhiêu chuyện mà mình không thể bảo vệ cho con được, nó ngồi trong một cái máy đó, như là mời hết cả thế giới vô cái này luôn. Mà trong khi đó là mình lo bao nhiêu chuyện, nhưng mà cái đó nó lại vô nhà mình quá dễ. Và khi cái đầu của một đứa bé mà nó sáng ra, một cái nơi trong đầu mình đó, nó kêu là cái reward center. Cũng như là mình, ví dụ như mình đi chơi một cái trò chơi gì và mình cảm thấy như là mình là người chiến thắng á, cái nó thả ra cái chất neurotransmitter dopamine, nó làm cho mình cảm giác là rất là vui và rất là có sức mạnh ha, cái tự tin đó. Thì cái dopamine đó nó làm cho mình nó rất là muốn trở lại cái cảm tưởng đó. Và trong cái mà dùng cái reward center này mà theo kiểu mà lành mạnh á, là mình tập cho con biết học đờn, tập cho con biết học võ, tập cho con biết đi chơi cái này cái nọ và đi du lịch để mà cho con thấy được cái chuyện này chuyện nọ, hoặc là con tự tay con làm ra được một cái ly gốm, hay là con tạo ra một cái tấm hình đó, và con sẽ được những cái cảm tưởng dopamine reward đó nó trở lại nữa. Đó, cái đó là một cái bên lành mạnh. Nhưng cái đó là một cái là bên đó là mình chính là người sản xuất ra cái việc để cho mình lành mạnh. Có một cái gì nè,
Sự tự tin.
một cái trải nghiệm lành mạnh và cái sự tự tin của chính mình. Ngược lại, khi mà mình cứ ngồi đó mình consume, mình chỉ là hấp thụ thôi, không cần làm gì hết, nó kêu là low effort, cứ ngồi đó cứ quẹt ha, thì cái đầu mình nó thay đổi, nó thành nó chuyển qua từ cái nơi là creative, sáng tạo, tới thành cái nơi là receptive, là chỉ ngồi đó nghe thôi. Passive ha. Đó. Nhưng mà cái algorithm của những cái phần mềm AI này kia đó, và TikTok á, và Instagram hay là cái gì, miễn sao là con mắt mình nó dính vô cái màn ảnh á là nó thắng. Vì con mắt mình và cái sự chú ý của mình á là cái tiền bạc, là cái commodity ha. Nó mà nó dành được bao nhiêu thời gian của con mắt mình dính vô cái màn ảnh á, là con mắt mình nó sẽ là nó thắng. Vì nó thắng được đó là phần nó quảng cáo cho mình, phần mình consume cái đồ của nó, phần mình bị nó ảnh hưởng, và phần nó collect data về mình. Cái con mắt của mình nhìn ở đâu trong cái màn ảnh á, nó so được hết. Bao nhiêu lần mình coi cái gì á, nó cũng nhớ, nó thâu được hết. Thì là tại sao khi mà mình nói về cái chuyến đi chơi ở đâu, có tự nhiên cái là mình thấy toàn là những cái chuyến đi chơi đó, nó đem nó vô cái phone của mình. Đó là vì nó vừa nghe và nó vừa biết, và nó đẩy vô cho nó content specific cho cái người đó. Thì bây giờ nó càng nguy hiểm hơn, vì chính mình lại nghe được những cái gì mình thích nghe và muốn nghe, và lại là bị nghe nhiều hơn nữa. Thì cái cycle đó nó làm cho mình thành một cái người nạn nhân của những cái content nó đẩy xuống cho mình. Thì mình đã đổi từ creator qua receiver. Cái kỷ luật là cái quan trọng. Trước khi bố mẹ la mắng con cái là con không được dùng cái phone đó nữa, con không được vô cái computer đó nữa, không được chơi game nữa, thì mình phải hỏi, giống như hồi nãy mình nói đó, khi mà mình chữa bệnh cho bố mẹ mà đem con vô mà nói chữa bệnh cho con tôi đó, thì mình cũng hỏi một câu rất là rõ ràng là thói quen của bố mẹ chơi với điện thoại và màn ảnh như thế nào, và cách mà bố mẹ dạy con trong lúc mà con ghiền game á, nó như thế nào. Tôi chán nó quá, tôi nói hoài nó không nghe, xong rồi tôi cứ để cho nó làm vậy luôn chứ sao giờ. Cái đó là một cái cơ hội ở đó, phải không? Mình đã chịu thua vì mình cảm thấy chán nản và mình không có thể mà thuyết phục được con mình vô một cái kỷ luật, vì mình cũng chán quá, mình mệt quá, đi làm cả ngày về xong cái nó thôi kệ nó bây giờ cãi với nó xong rồi nó la ó lên, người ta cũng mệt quá, thôi cứ để nó đi, xong rồi tao đi làm chuyện tao, nó đi làm chuyện nó. Đó là một cái cơ hội bị mất. Cho nên trước khi mình la mắng con mình và đòi hỏi kỷ luật con mình phải có kỷ luật chính mình. Bố mẹ nói chứ con ơi, con đừng có dùng phone nữa, mà trong khi đó bố mẹ cứ quẹt cái phone hoài, đâu có công bằng, phải không? Đó, cái câu này á, thì mình nghĩ nó không có khó, nhưng mà cái áp dụng cho cái mình kêu là một trong những cái lớp mình dạy á, nó kêu là thói quen nguyên tử, là Atomic Habits. Ok, là cái cuốn sách này nó dạy cho mình là ai, cái identity của mình là như thế nào. Nó sẽ từ những cái thói quen mình làm hàng ngày. Nếu mà cái thói quen của mình đó là mình ngủ dậy và mình đi tập thể dục và mình đi đọc sách và mình đi làm những cái chuyện lành mạnh mà nó trọn vẹn á, thì nó khác với lại một người mà ngủ dậy xong cái là nhìn cái phone cái là quẹt. Đó, thì cái thói quen hàng ngày của mình nó sẽ đẩy mình tới là mình là ai và mình người như thế nào, và càng ngày lại càng bị thu hút vô cái màn ảnh, mê game, mê doom scrolling đi, giống vậy đó, thì nó làm cho mình bị mất đi cái kỷ luật còn nhiều hơn. Thì cái quan trọng đó là phải có cái kỷ luật.
Thank you for listening to The Vietnamese with Kenneth Nguyen. Special thanks to Brittany Tran, to Jane Nguyen, Catherine Nguyen, Tina Pham, Sydney Jamie, and Crystal Trin. Please find us on Instagram, Facebook, and TikTok at The Vietnamese Podcast.